How sugar affects the human body, a comprehensive exploration. Sugar, often viewed as a necessary energy source, plays a significant role in our diet as a carbohydrate. However, distinguishing between natural sugars, found in whole foods such as fruits and vegetables, and the refined added sugars prevalent in processed foods is crucial. While fruits and vegetables furnish essential nutrients and fiber, refined sugars can wreak havoc on the body. This article is curated for healthcare professionals and those keeping abreast of lifestyle trends, aiming to illuminate the intricate impacts of sugar consumption on various bodily systems. Sugar has a profound influence on the brain, primarily through its effects on neurotransmitter activity. The connection begins with dopamine, a neurotransmitter associated with pleasure and reward. Consumption of sugar triggers dopamine release, fostering a cycle akin to substance addiction, warranting serious consideration from healthcare providers. Such addictive patterns reinforce excessive sugar intake, leading to persistent cravings. Furthermore, the episodic roller coaster of blood sugar levels induced by high sugar consumption is a recipe for mood instability. These fluctuations can manifest as irritability, fatigue, and mood swings, impacting daily functioning and mental well-being. More alarmingly, chronic high sugar intake is linked to impaired cognitive functions and elevates the risk of neurodegenerative diseases like Alzheimer's, underscoring the need for awareness and preventive strategies amongst health practitioners. The heart, a crucial organ for sustaining life, bears significant scrutiny in discussions concerning sugar. Elevated sugar intake corresponds with increased triglyceride levels, inflammation, and hypertension, which collectively elevate the risk of heart disease. As many healthcare professionals would affirm, such metabolic disturbances are precursors to critical conditions like heart attacks and strokes. In particular, the role of sugar in fostering atherosclerosis, the hardening and narrowing of arteries, should not be underestimated. This process impedes blood flow, demanding timely intervention to tailor patient advice and dietary recommendations. While fructose, a form of sugar, is a natural fruit component, its excessive presence in processed forms like high fructose corn syrup overloads the liver. This can lead to non-alcoholic fatty liver disease, NAFLD, a growing concern among medical professionals. The liver, attempting to metabolize excess fructose, converts it into fat, posing long-term health risks, including cirrhosis and liver failure. Moreover, an overburdened liver due to excessive sugar may produce harmful byproducts, including uric acid, which can precipitate conditions such as gout and contribute to kidney stone formation. These elements underscore the need for effective dietary counseling in clinical practice. Turning our attention to the pancreas, known for its critical role in insulin production, it's evident that high sugar consumption poses threats leading to insulin resistance. This resistance is a known precursor to type 2 diabetes, a condition prevalent in today's society. Excessive sugar intake can overwhelm the pancreas, reducing its efficacy and triggering chronic ailments. The pancreas' role in maintaining glucose homeostasis becomes overtaxed, leading to insulin burnout. This scenario, familiar to healthcare providers, highlights the cascading effects of unmanaged sugar consumption and the importance of patient education on dietary habits. In the digestive system, sugar primarily influences the gut microbiome, creating an imbalance between beneficial and harmful bacteria. This disturbance can cause bloating, inflammation, and discomfort, impacting overall digestive health. For professionals in gastroenterology, addressing these imbalances is crucial in mitigating digestive disorders. Equally concerning is the correlation between chronic inflammation and cancer risk, especially in the colon. The pro-inflammatory environment spurred by sugar fosters conditions conducive to cancer cell proliferation, demanding informed discussion and dietary modifications in patient care. Kidneys, essential for filtering waste and excess substances from the blood, are particularly sensitive to elevated blood sugar levels. For individuals with diabetes, this strain can progress to nephropathy or kidney failure. Furthermore, sugar-induced dehydration, due to increased urination frequency, emphasizes the importance of balanced hydration strategies in clinical settings. The impact of sugar on skin health cannot be overlooked, particularly in lifestyle and beauty blogs. The glycation process, where sugar binds to proteins, degrades collagen and elastin, leading to premature aging signs. Additionally, increased insulin levels spur sebaceous activity, exacerbating acne, a common dermatological issue. These insights provide valuable information for specialists focusing on skincare and aesthetics. Sugar's notoriety in fostering cavities and tooth decay is well documented, with oral bacteria metabolizing sugar into decay-inducing acids. The resultant enamel erosion and gum disease necessitate preventive dental care and patient guidance. Excess sugar not only exacerbates inflammatory conditions such as arthritis, but may also hinder calcium absorption, compromising bone strength. This connection is salient for professionals focusing on musculoskeletal health, highlighting an area for potential patient guidance regarding diet and lifestyle. The epidemic of obesity is inextricably linked to excessive sugar intake, given sugar's high caloric yet nutrient-poor nature. Visceral fat accumulation around the abdomen and the onset of metabolic syndrome necessitate urgent attention from healthcare professionals. Addressing these conditions involves lifestyle interventions and fostering awareness about the importance of managing sugar intake. High sugar levels are known to suppress immune function by impairing white blood cell activity. This effect is particularly noteworthy during flu and cold seasons, underscoring the importance of dietary management to maintain robust immunity. A consistent pattern of high sugar consumption can increase chronic disease burden, including type 2 diabetes, cardiovascular disease, cognitive decline, and cancer. As healthcare providers and lifestyle educators, the mission is clear: emphasize reduction of added sugars to less than 10% of daily caloric intake. To effectively counter these risks, encourage a diet rich in whole foods, natural sugars, and balanced macronutrients, principles central to both patient care and lifestyle advocacy. By instilling these habits, we can safeguard long-term health and well-being. Thanks for watching. If you liked the video, please subscribe, like, comment, and share.